In case you're doubting Mewing, keep on watching because this video will completely change the way you view it. I will show you rare disease but very real cases of people with compromised tongues, the ways it affects their anatomy and facial structure, and you'll be able to compare the consequences of such disease to the ones that low tongue posture and poor orthodontic treatment bring. Most importantly, it will bring you clarity and allow you to make a proper decision more easily when deciding what is the right way to improve your facial structure and to whom you can trust in the process. So the best way to understand the function of a structure is to observe what happens when the structure is absent. So in the 18th century first appeared a disease, or better called anomaly, which was reflected in the absence of the tongue. Sometimes it was caused by the syndrome or by more complex genetic mutations. Other times it would simply be the absence of a tongue because of the failure in a tongue embryogenesis process. And this discernment is crucial since the structural state of the face in this case needs to be exclusively a product of the absence of the structure, in this case the absence of a tongue, not of any other reason. Such absence of a tongue is called aglossia, and aglossia is relevant while trying to understand the effect Mewing has on a face because Mewing hypothesis claims that by applying pressure on the upper palate or on the palatine suture, maxilla expands, it moves forward, and the airways are positively affected by that posture. On the contrary, keeping the low tongue posture leads to compromised airways, collapsed palate, crooked teeth, and setback jaws. But what happens when a tongue is completely absent? The airways of the individuals with aglossia are dangerously narrowed down. The upper and lower palate are both collapsed, not providing sufficient space for all the teeth, of course. Facial aesthetic is negatively affected in a way that there is misalignment in the bite, chin is recessed, both the jaws are set back, lips are protruding, and the facial muscles are not used in an optimal way. We can consider consequences of aglossia as more exaggerated consequences of the poor oral posture, and this realization proves not only the importance of the tongue, but it reveals all the functions of the tongue as well. Therefore, claiming that the tongue posture, proper swallowing and chewing balance don't have a significant role in the early facial development is simply wrong. Aglossia doesn't only prove the significance of the tongue in the early facial development, but in a later one as well. In cases of adult, partial or full loss of a tongue, there are very similar consequences on the teeth alignment, facial development, and all the other issues. This is actually very well understood. That's why aglossia patients undergo not only surgeries but other procedures like using certain appliances such as palatal expanders and palatal lift prosthetics in order to compensate for the lack of a tongue support. And therapy used for such cases reveals that the functions of a tongue are known, just as the consequences of the improper tongue posture are known as well. And that brings the question, why would such knowledge be ignored in the whole field of orthodontics? Not only the knowledge is ignored, but often the opposite is practiced when, for example, the orthodontic treatment involves teeth extractions, which make a palate even more narrow and the airways even more restricted. So the issue is not the lack of knowledge, but something that's far greater, which is ignorance and the greediness. Orthodontistry is often like a closed circle in which not many other specialists are welcome. Therefore, it's hard to influence and enhance their treatments. But there are certainly specialists who would be competent to do so, such as ENT doctors or maxillofacial surgeons, for example, who often repair the damage that's done by orthodontic treatment. But the direct involvement in their practice is greatly unappreciated, which has been demonstrated by the work of John and Mike Mew. And with that being said, I want to leave you with a verse you should be applying in case you're looking for the solution. Everything is available, but not everything serves you. Okay, so when choosing the orthodontist, please make sure you're not compromising your airways or your facial structure to gain improvement in the teeth alignment. Make sure your palate is not affected negatively by the treatment, and if it's possible, that by the end of the treatment your palate is actually expanded. Please don't blindly follow those who refuse to change their ways and those who refuse to incorporate widely accepted knowledge in a scientific world. There are certainly alternative options which are maybe not widely known or accessible, but they're far more beneficial for you. And in case you need more guidance or in case you have any question, really, please reach out to me and I will gladly help you. Thank you for watching, and bye.